Time is running out if you have a healthcare flexible spending account. Just 11 days left to spend the money that you've put aside, those pre-tax dollars.
Here to help us use that money and not lose it, financial contributor Carmen Wong Ulrich, who is with us again this morning. Good to see you here.
Hello.
So do you really have to spend all this money, or is it just
You do.
Like
At some point you have to. For a lot of folks, it's now. It's at the end of this year. Some companies give you an extension till March 15th, so you got to make sure that you check and see when your deadline is, because if you saved up that money and you haven't used it by the 31st, by next week, it is gone.
Yeah. And millions of Americans use this. So 40 million Americans.
Yep,
I have
40
to say,
million.
I've been using it for years. I'm a big fan. But there are some changes. We talked a little bit about this during open enrollment time, but there are some changes heading forward to which we really need to be aware of.
Exactly. Well, let's take a look at what the FSA does cover, your spending account can cover for you now, today. Okay, so for this year, dental work and cleaning, physical exams, eye and hearing exams, even acupuncture, chiropractic, prescriptions and your co-pays, and your medical equipment. So that is also still covered, of course. But here's what's not covered anymore: over-the-counter medications. Now, this used to be covered 2010 and previous. 2011, this is new. Over-the-counter medications like allergy medication or ibuprofen, not covered anymore. Drugstore items such as contact lens solution, that used to be covered. No cosmetic procedures, and not your insurance premiums either.
So this is a lot of things people really need to kind of be aware of now.
Yes, you have to be aware and adjust your plan for next year. If you have a ton of money left over now, and because of these changes you find yourself with too much money, make sure that you adjust what's withdrawn from your paycheck for next year.
What about health savings accounts? Same type of rules in play?
Very different. Very different. Really? FSA, HSA, very different. Health savings account is like a trust, consider it a 401k type style thing to save for your health care costs. Now, you have to be part of a high deductible insurance plan, or you have to have no insurance coverage to qualify for an HSA. Think of it as a 401k for your health coverage. Now, this is portable, right? So it goes with you from job to job, or if you lose your job, you can always have it. Contributions, tax deductible. Employer contributions, not considered income. And you can invest this money. So you can keep this forever like a 401k to save, because healthcare costs are going to be 30% of your costs in retirement. So the interest is tax-free. And like I said, it goes with you wherever you are.
If people are sitting back home and they're right now just a little bit confused as to where to go to make sure that all of this is in play before the first of the year, what measures do they need to take?
First, you got to go to your benefits provider. You got to go to your paperwork. I know this is the boring part of the deal, but this is money we're talking about here. Make sure you check out your FSA, make some adjustments for next year, and see if you're qualified for an HSA, because like a lot of folks, their health care coverage changed this year and they're spending more money on it. They may qualify for an HSA, and it's really valuable. You can save a lot of money.
And in terms of, the not so fun part of all this, I guess the other great way to make sure that you're putting aside the right amount of money is go back and look at all those receipts.
Exactly, and I bet you do that since you're a big fan of the program.
I try to. I'm not as good about it as I should be. I'm no Carmen.
I'll help you do it. But it's very, very worthwhile, because that money is all pre-tax money that you can put away. So let's say if you're in a general tax bracket, that's $33 of every $100 that you put away. That's a lot of money.
And once you have kids, or if you have elderly parents that you're caring for, any of that, to be able to, every time you go to the doctor, all of that, really important.
Exactly.
You need to get a Carmen app for your iPhone just so you can
I'm building one.
I do need a Carmen app.
Carmen app.
Luckily, I have her cell phone number.
Thank you, Carmen.
Thank you.
Great to see you.